got it. Okay. Well, good. Welcome, everybody. We'll get started now. I think we'll have, like I said, maybe 2 or 3 folks coming in, but we'll let them in as they come. I think I know just about everyone here. So, you know, Sue and Dale, you guys are a little bit newer, and then I'm not sure with the other folks. But welcome to the clinic. Welcome to Gordon Physical Therapy. My name is Luke. I'll be talking to you for the next 3 hours about neck pain and headaches.
Oh, dandy.
Yeah, I gotta leave in an hour.
Yeah.
You gonna give us drugs?
Yeah, exactly. Yeah. Yeah, marijuana brownies. Did you have one of those, Jim?
I did.
Yeah.
Oh,
Real cool, man.
Guys,
I
good.
wanted to try that.
Yeah.
Outstanding.
Yeah. My standard workshop joke. It never gets old. Okay. Yeah. So no, we will go about an hour or so, depending on questions and stuff like that. We've got the worksheet, so we have kind of an agenda to get through in terms of the information I want to cover. But the nice thing with the workshop is that it's very interactive. So if you have a question that kind of pops up as we're going along, feel free to raise your hand or shout it out. It's a small enough group that we can make it pretty catered to specific questions. So feel free to interrupt me at any time. And quick introduction to neck pain and headaches. This is one of the major things we treat at the clinic, along with things like back pain and sciatica and shoulder pain and a variety of other types of things. The interesting thing with neck pain and headaches is that a lot of people have them, and a lot of people deal with them for a long time. A long time. So it's not uncommon for a patient to be coming in here, and we're first interviewing them and saying, well, how long have you been dealing with this? Oh, it's been 5-10 years or whatever. And the reason that I think people just deal with it for so long is that unlike, let's say, a leg issue, you can just kind of keep going with neck pain. You can kind of power through a lot of times. Doesn't mean that's a good decision. But whereas with like a knee pain or a low back pain, that potentially affects your mobility. So you can't walk, you can't run, you can't do a specific sport or activity. But with neck pain, most folks can kind of just power through for a long time. And again, I don't think that's a good thing, but it is common. So if that sounds like you, don't feel too bad. You're probably in the same boat as everyone else. That boat that's slowly sinking. Yeah. Yeah, no, I'm just kidding.
It's starting to capsize.
It's a comforting thought.
Yeah, exactly.
Yeah.
Yeah. It will never really sink, right? No, but we'll be here when it does. And then the other thing I wanted to just say for the introduction to neck pain and headaches is that I think there's a few factors that are making it more common nowadays. And one of those factors is that a lot of people work in front of computers nowadays. I mean, I think this generation especially, there's more and more people who just sit all day at work in front of a screen. Whereas, let's say 30, 40 years ago, there wasn't really as much downtime at an office. So, especially some of these bigger groups where there's, like a Vista or something like that, where you've got 600 people working on computers all day, it's going to be really common for them to start to build tension and stress in their neck. So that's one of the big things. And then I think, technology, again, with, the handheld devices, the phones, the tablets, all the looking down that people do is really one of those factors that, again, makes headaches more and more common nowadays. So we treat more neck pain and headaches in the last couple of years than I think we have, at least in my experience, as long as I've been paying attention. So it's getting much more common. So again, you're not alone if you find yourself with neck pain and headaches. Okay, so first thing we're going to cover, and like I said, feel free to interrupt me at any time, is we're going to look, number one there, just what structures are involved when you talk about neck pain and headaches. So that first one is the cervical discs are involved. So that's the first blank there is discs. So when you look at your neck and just your spine in general, you've got the bones, which are the vertebrae. And let's just say from a side view, they kind of look like that. And then in between them, you'll have the discs. So those are your discs right there. And like it says on the worksheet there, they're your natural shock absorbers. Same structure is going to follow all the way through your spine. You got your neck, mid-back, low back, or in the medical world, you've got cervical, thoracic, lumbar. So the same basic structure is going to follow throughout your spine. But in the neck, as with any part of there, you can have issues with the discs. So depending on what type of an issue you have, like a disc bulge, that's going to produce some level of symptoms. And then you get things like degenerative discs and things like that. Which, Steve, you were kind of mentioning that. Probably found some of that on your recent report you were saying, right?
Yes.
Did you have the D word in there? Severe degenerative
The
discs.
discs are laying on each other.
Yeah. How many folks in here, by the way, have had imaging on their neck, either X-rays or MRIs?
X-rays?
X-rays, okay. Have you run into those terms before? Degenerative discs? Okay. So basically, if you think of a disc as like a jelly donut or a kind of a squishy substance, and it has a certain level of height to it, a degenerative disc is going to be shrinking in height. So kind of like gravity is winning over time and it's squishing down. Another common, mental image you can use is picture a grape and then picture a grape dehydrating into a raisin. So, yeah. Yeah.
Grapes deflated.
There you go.
Doesn't the grape have to die?
Grape got popped.
Yeah.
Yeah.
3
Yep.
times.
So the discs can be a cause of pain in your neck. Mainly you're going to see degenerative type pain. You can also get disc bulges in your neck. They're not super common, whereas like a lumbar disc bulge is very common. You will get some disc bulging in the neck, and a severe one, just like the low back, could cause nerve pain if it touches that nerve right as it leaves. So that's one other cause of neck pain. So that's the top one, the cervical discs. The second one, B, is the facet joints. If you don't know how to spell facet, I'll jot it down, F-A-C-E-T. So the facet joints, just like any part in your body that moves, you've got joints, so the bones are articulating and moving on each other. So when you turn your head side to side, the bones are along the back of the spine there. It would be where the bony structures of the vertebrae would connect. This isn't a very good picture as it turns out, but it would be where the two bones connect. So you've got 7 vertebrae in your neck, and they call them, like on an x-ray, C1, C2, 3, 4, 5, 6, 7. At each of those segments, those little joints are going to be moving. So anyone here with a stiff neck? Can't move very well? Okay. You can just imagine, you're turning this far, and then it just feels like you hit like a solid block there. So your facet joints aren't moving anymore. So the joints get stuck. And that could be because you've got degenerative discs and degenerative joints, and because the joints, the facet joints are being squished, and there's pain there too. Just like any joint in your body, there's cartilage, so you can have arthritis there as the cartilage wears away, just like a knee or a hip or anything like that. And like it says on your sheet, these facet joints are going to experience constant repetitive motion. So again, anytime you move your head, and when inflamed, they can cause pain. That second space, that left blank there, is stiffness and soreness. So that's your second cause of pain in the neck. Go ahead, Jim.
Yeah, I've got pain in my neck, but I also have it right here.
Mm-hmm.
I was wondering.
So pain right here, yeah.
Yeah.
That's pretty much the next one.
Shoulder.
So C is your muscles. Muscles. So you've got a lot of muscles surrounding your neck. Basically, they're attaching your neck and your head to your shoulders, your rib cage, things like that. So where were you pointing, Jim? Kind of on top of your shoulders
top
there?
here.
That's a common spot. And where do I have that on here somewhere? Let's talk about that one here soon. Yeah, so there's a lot of muscles around your neck. You've got little ones on the side. You've got those big ones there. And then this is actually the second blank on C there. This includes your suboccipital muscles. So suboccipital is that next blank. That's right. Actually, I just made that one up. So suboccipital is that second blank. Lots of muscle groups. Now, when it comes to, you've got pain in the neck, and then you've got headaches as well. Not everyone with neck pain has headaches, although certainly a good majority of them do. When they do have headaches, a lot of times the muscles are involved. So you'll get things like trigger points down here and those big muscles there. You'll get issues with real sore muscles here, and then a really common culprit is the suboccipital muscles, are those ones at the base of your skull.
Yeah.
So kind of from the bottom of your skull down to like the middle of your neck roughly. Those ones, if you really push on those can really cause headaches because they've got little nerves running through there. So you get the headaches that kind of go around to the front of your face, kind of behind the eyeball, and sometimes it could be, yeah, point at
He
you
said
again.
it feels like a
Yeah.
spoon is gouging his left eye out.
Yeah, you feel like that real tension back there. So definitely the muscles can be a cause not only of the neck pain, but also of those headaches. You guys with me so far? What's that, Gil?
What can you do for the pain? They haven't given him anything.
So I'll skip ahead.
Yes, okay, sorry.
You're good, Gil. No. So the question, what can you do for the pain? So first step, which is going to be way down here, is you got to figure out what's causing the pain. Is it more of a joint issue? Is it a disc issue? Is it the muscles? As life would have it, usually it's a combination. It could be 2 or 3. It could be all of them if you're lucky, like Steve, right? And then you just go about treating which areas. So especially like with those suboccipital muscles, there's some release techniques you can do, and especially like I was mentioning, like trigger point type therapy to relieve the
Sorry,
muscles.
I'm so sorry.
No, you're good. Go
My
ahead.
massage gal loves to work on those.
Yeah. Oh yeah.
It's not fun.
No. Yeah. So yeah, massage therapist likes to get in there and work on them. There's a lot of actually pretty nice like self-massage tools out these days that we encourage, you know, especially for those folks sitting at the desk all day and you end up getting all that tension in your upper shoulders. I mean, you know, we're trying to correct things and correct their posture and do stretches that way. But also, you know, doing some self-massage is pretty valuable. So there's some nice, you can buy everything on Amazon these days, so one-click shopping. Okay, so the last one for causes of pain in the neck is the nerve roots. So that last blank is nerve. Kind of alluded to those when we were talking about the discs. So if the disc bulge and puts pressure on the nerve root, you're going to experience some pain along the, you know, along the distribution of that nerve. So that's when you get pain down into your arms. And other things that could cause those nerve roots to be inflamed are any of the degenerative type things, the facet, the disc. Basically, again, my drawing isn't great, but if you could imagine, the bones on the 2 vertebrae are actually, they're actually connecting to each other, like that.
Really good sample on the other side.
I know, I do have a model. It might be smart, huh? But along the side of every vertebrae in your body, neck, mid-back, low back, you've got this much space, let's say, right there, for each nerve root to pop out the sides of your spine. So if your spinal cord was running straight down the middle of your back that way, along each little area there, you would have a space for a nerve root to pop out. Now if you see this on an MRI or an X-ray, they'll talk about like the foramen or the foraminal this, the foraminal that, the foraminal stenosis, things like that. So again, that's saying there's this much room for the nerve to run through and be nice and happy and calm, and if anything touches that nerve, things are going to go wrong. So again, if the disc bulges this way and touches that nerve, that's a bad idea. If the joints start to compress this way and that way and touch that nerve, then you're going to feel nerve pain. The other thing you'll see with the joints is that they'll start to thicken over time as they become arthritic. So as that thickens and takes up more space in that spinal region, anything that's going to take space away from that nerve root potentially is going to cause that. And again, you're usually thinking of nerves if you have like numbness, tingling, pain coming down the arm. Anyone have any of that type of stuff? Yeah, okay.
Off and on.
Off and on.
I used to have it worse than I have now, but yeah, I'm sorry.
Yeah. And actually, like I was just telling Gail, the thing you want to realize with any of this type of pain is you got to figure out, okay, is it actually coming from a nerve root in the neck? Because there's other ways that you can get nerve issues in your arms. You can get nerve entrapment down here, like thoracic outlet type things. So there's different ways that we test for where's the pain coming from.
How would you find out? Would you take an X-ray or something like that, or would you just go through a process?
So how do you find out if the nerve root is being impinged
Yeah.
and causing
Yeah.
pain down the arm?
Exactly.
Yeah. So basically the way we do that as therapists is just run through physical exam. What reproduces the pain will usually tell us where it's coming from. So for instance, in general, let's say you had pain running down your left arm. If you tipped your head back and there were certain head motions like that caused the pain to worsen, that's a pretty good clue that it's coming from your neck. Whereas if all of your neck movements didn't have anything to do with that arm pain, and then we tested further out like in the shoulder or in the nerves down through here. So we're just looking for ways to reproduce the pain, basically, and that gives us an idea. Yeah. Good. Do all those make sense so far? Just to kind of orient yourselves to the spine. Anyone have any other questions before we keep going on? Get right through this stuff. Okay, so let's talk about the most common causes of neck pain then. And I mentioned some of this a little earlier when I was talking about people sitting in front of computers and whatnot, is that that first one is postural stress.
Well, now, that might be the best answer where you came from, but where I came from, we were always told it was from the spouse.
From the spouse. Yeah. Yes.
Okay.
That's what my wife would tell you. I'll tell you,
Some humor in there.
I'll tell you, yeah. I'll tell you where my neck pain comes from. I thought that was pain in the butt.
That too.
Yeah, okay. Pain in the neck.
Yeah.
That just goes out for everything. Yeah. So postural stress, sitting really just is rough, which is always ironic because I do, workshops on different topics, and usually later in the workshop I'm saying, the worst thing you could do is sit like on a hard chair while someone talks to you at a workshop.
Yeah.
So if anyone feels the need to stretch and walk around, please do so. Get the whole clinic to
So
ourselves.
this is the way you get more clients.
Exactly. Putting you all in pain, and then we'll offer a solution at the end.
The only relief I can get from my pain is in a recliner.
You have to decompress.
Yeah, it's the only thing that takes any of the pressure off.
Mhm.
And it's, I'm 90% miserable.
Yeah.
And it sucks.
Yeah. So yeah, you're basically leaning back in a recliner and taking the pressure off
Yeah.
of taking the weight of your head off of your joints and things. So anyone else here on Facebook? So Facebook caters ads based on who you are. Facebook knows everything there is to know about you. It's kind of creepy, but it is what it is. So Facebook knows I'm a physical therapist. So if I scroll through my news feed, which I do like maybe once a week because I don't like Facebook in general, but once a week, I'll be real bored. And so it'll hit me with all of these ads for physical therapy related products because it knows that I'm a physical therapist. And so once in a while I'll actually buy something. And one of the ones I just bought was one of those neck hammocks. Have you seen those online yet?
Yes,
Yeah.
yes.
My neighbor got one, she swears by it. But
Is it hooked up to a doorknob or something?
yeah, it's like a little sling you just rest your head on and you hook it up to a little doorknob and it just floats your head for you. So it's like taking the weight off of your head.
Is that the water bottle over the back?
No, that's a traction device. The
Oh,
neck
okay.
hammock would be very, very mild. But anyway, so yeah, you look at things like that, just taking the weight of your head off of your neck is pretty, relieving at times. So they got me on this ad on my Facebook, and I'm sitting there, I was like, all right, I'm gonna order this thing, and I ordered it, and then I bought it, and then it says, oh, well, by the way, you can expect it in 6 weeks, and I was like, oh,
Yeah.
rats. So
6 weeks.
I'll keep you posted on how well those work. But a lot of times with treatment of the neck, again, to kind of jump ahead, we'll do things like, hands-on, stretch your neck lengthwise. And for a lot of folks with the more degenerative pain, that feels really good just to take that pressure off. And then, long-term, it's nice to figure out some ways to do that on your own. Okay, so postural stress, in general, it just causes a lot of tension through the neck, the shoulders. You picture those computer workers, especially if they have their arms outstretched and they're in a poor postural position, which is going to be pretty common. You're going to get certain muscles that just get really stretched. And the way we look at it mechanically is that when you're in, let's say, that forward head posture, like that, when you're sitting for long periods, some of these muscles are going to get stretched and some of them are going to get shortened. So either way, they're getting stressed out. When they get real shortened, like these ones up here tend to get shortened, whereas these ones here are getting stretched and kind of overused. Either way, it's going to put pressure on the muscles, potentially those nerves that run through them, and it's going to result in pain and headaches. So that's the first one. Most common cause we see is that first postural stress one. And the spouse, of course. Yep. Second one that's fairly common is, that blank is acceleration. Acceleration injuries, also known as whiplash.
Yes.
Acceleration. The interesting things with these is that we treat a lot of patients after a car accident. It's kind of an obvious one. You're in a lot of pain, so go get treatment. Further down the road, 10 years later, 20 years later, 30 years later, a lot of the folks that come see us then have had a car accident. And their pain maybe didn't quite go all the way away 20 years ago, but good enough was good enough. life goes on. And like I was saying earlier, a lot of folks can tough it out through neck pain. If it's not limiting their ability to do certain things, they just kind of tough it out. So, anyone here been in a car accident? Yeah. Yeah. Okay. Rest my point there. Rest my case. And you're gonna get potentially more than just headaches and neck pain with whiplash injuries. So I put that on your sheet there. You can get headaches. You can get fatigue. You can get vertigo if you're not too lucky. Concentration can be an issue, mainly because you're losing sleep and because pain really does fatigue you. And then sensitivity to noise and light. So vertigo is kind of a weird subject. Anyone ever have vertigo? Yeah, Gales has. Okay, yeah. Sometimes vertigo can be caused by neck pain. The average person we treat here in the clinic with vertigo has like the little crystals loose in their inner ear. It's more something along those lines. Well, if you consider a car accident, you very easily could get, jostled. You could get a crystal loose in your ear. So, what's that?
Too rough old life.
Oh yeah, yeah. Seasickness. Yep. Okay, and then the last one I've already kind of talked about a little bit too, but it's degenerative changes. Degenerative. Does anyone know the fancy terms for that, like on your X-ray or MRI? How do they tend to describe degenerative changes?
Money.
Osteoarthritis could be money. Yeah, they don't put that on your MRI.
Yeah.
Yeah. So you could get degenerative joint disease. So that'd be DJD, degenerative disc disease.
Bone disease. That's what I have in my thumb.
It'd be the same thing as joint.
I also have osteoarthritis too, but my right thumb is crooked and they said I have degenerative bone disease. What is the difference?
There's no difference. They're all synonymous. Yeah. Yeah. Osteoarthritis.
Yeah, I have
Yeah, it's all pretty much different ways of describing the same thing.
It's just in a different spot maybe. That's one's more maybe a joint and the other's more than just the bone.
Well, it's all the joint. It's all the joint. It's just the cartilage wearing away. Yeah. Which that's easiest to see on an X-ray. Because on an X-ray, between a joint, there's space. So the bones will appear white and the space will appear black. That space is the cartilage. And so on an X-ray, as that space gets smaller and smaller, that's what they use to quantify the amount of osteoarthritis or degenerative joint disease. You'll hear other descriptive terms like degenerative disc disease. So again, that disc is just kind of being squished. And then stenosis is another common term you'll hear. Stenosis. So again, stenosis is basically anytime you have a passageway or like a hole, let's say, if it gets smaller, that's what we use. Narrowing is stenosis. So you'll hear all sorts of descriptive terms. While we're on that topic, then, any questions about specific verbiage on reports that didn't quite make sense? Alphabet soup? Nothing too much? Okay. We'll keep those in mind as we go along. Cruising here. Okay. So, who knows this next one? The biggest mistake the neck pain and headache sufferers make.
Ignore it.
They ignore it.
Yeah.
You guys are a good, smart group. They ignore it.
Been there.
B is, or they mask it.
Is what?
Mask it.
Yes. Yeah.
Mask it, cover it,
Like with the aspirin or something like that.
Exactly.
You're not, yeah.
with a painkiller.
You're really
The
not.
spray.
Yeah, yeah. Not that there's anything wrong, with a topical this or, temporary pain relief. But overall, if you're masking your pain for a prolonged period, you really haven't accomplished anything. You haven't figured out what's going on. You haven't fixed it. And if you're on, potentially you're causing lasting structural damage. So those are the big mistakes. And again, it's understandable why folks make it because, it takes time and effort and energy and sometimes money to get things looked at. So commonly done. C, then what they should do is handle it. There we go. That's right. Yeah. Yeah. And handle it makes it sound like it's really easy. Oh, just handle it. Why not? But obviously there is some work involved. Figuring out what's going on, figuring out what's your best treatment options, figuring out if there's things you can do to avoid an injection or surgery, and just going through that process. But
We'll just have a little therapy on my leg.
yes, exactly. Yep.
get the injections out.
So let's talk then about how we successfully eliminate these issues with neck pain and headaches. The first step, which we kind of talked about already, is you got to determine the root cause of the pain. The root cause. So before you go in and start treating it, understand what's going on. You know, figure out, is it the joints? Is it the discs? Are there nerves involved? Are there other underlying things that are involved? Do a few of you read my stuff in the newspaper once in a while? Did you read the one about the shoulder pain?
Yes.
Yeah. So that was a long time ago. Treat this guy for neck pain. He's getting chiropractic as well. Things should be going pretty well, and he's just not getting better. Turns out his real issue was his shoulder. So he had a rotator cuff issue. And so all of these muscles that I was trying to treat for him, which usually works pretty well, he'd only get temporary pain relief because at the end of the day, the shoulder was the issue. The weakness in the shoulder was causing him to over-recruit muscles in his neck. And until we figured out the shoulder, we could treat his neck all day long. Or you can go to the massage therapist all day long, but it's only going to be temporary relief. So before you dive into treatment, figure out what exactly is going on, and make sure you just kind of, you know, look at all of the potential involved structures. So that's step one. And then step two, this is my opinion, of course, but it's my workshop, so I can say what I want, right?
Exactly.
Combine, that blank is hands-on therapy. Combine hands-on therapy with specific stretches and exercises.
Okay.
Was the only blank there hands-on?
The 2 words is hands-on.
Hands-on, yep.
So how did you determine, and how long and all that this guy had problems in his shoulder? And normally you have to have a doctor's thing, right? So how come the I'm kind of trying to figure out how to get around misdiagnosis.
Well, the thing with, you know, my lesson learned, this was a long time ago, is that if someone's coming in for neck pain, don't assume that just because you figured out that he has some sore muscles, that's the cause. I mean, you get excited as a therapist. Hey, look at what I found. I can fix that. Kind of like a surgeon gets excited when he sees an MRI and says, I can fix that. You just have to be more thorough. So that's on my end as a therapist, to be more thorough when evaluating a patient and making sure we look at shoulders, upper back, neck, all those things that could be involved with it. And, you know, going one step further, you want to, you know, get a little more in-depth to what does he do for a living? What's he doing in his spare time? What are the factors that are really causing this? Because I can treat sore muscles all day long, but if I never get to understanding why they're sore in the first place.
Right.
Yeah.
The root, like you say, the root cause.
Mhm.
I was kind of wondering how much you're kind of contained by insurance, which does the doctor thing, and the doctor's, okay, you're going to treat him for the knee and it's his hip, or it's his foot, or, I mean, you know.
Yeah.
So that's why I was kind of wondering how you managed to get around all that.
You know, I don't feel constricted by that at all. Because if I feel like it's the shoulder causing the neck, I just roll it all in.
Yeah.
Insurance company,
And update the doctor or something, or.
they don't even really need to know, I don't think. I mean, because if the doctor writes a referral to me for neck pain, say, okay, well, if I believe the shoulder is causing the neck pain, I just write that up in my assessment, put it in my plan, so to speak.
Yeah.
You know, the way we do it with insurance is the doctor signs off on it.
Yeah.
Rarely would you imagine a doctor's actually reading my note. They're just signing off on it to get it off their desk,
Yeah.
which is fine. Hopefully they trust me to do my job well anyways.
I had issues with my shoulder due to the doctor not listening to the therapist, and the therapist continuing to do what the doctor did, even though but that's something you and I
Yeah.
can talk about later.
Yeah, well, you know,
That was 10, 12 years ago.
even if you're referred for something pretty specific, I mean, it's our job as therapists to do our own assessment and to really understand what's going on
And I
with you.
changed doctors.
Yeah. Well, and you mentioned like a knee and a hip. That's a better example probably than the neck, because let's say you're coming in for right hip pain, but your left knee and your left foot are actually what's causing the right hip.
Compensating and. yeah.
Exactly. So you've got to be thorough with that level of assessment.
Right.
And then, like I said, you know, some PTs might feel restricted that, well, I'm treating the right hip, how could I treat the left foot? It's like, well, I just put that in my assessment and I go for it. So, yeah. So with the neck especially though, step 2 is a big one for me. Hands-on therapy to me is a must with neck pain. There's only so much you can do stretch-wise to really get on top of neck pain. And a lot of times, if your joints are really locked up and your muscles are really stressed out, no amount of stretching in the world is really going to help you until you can take down some of that pain and get things moving again. So the hands-on treatment really is the big part of the success for our patients with neck pain and headaches. And we do a lot of hands. I mean, we're more of a hands-on clinic than I think a lot of clinics anyways, just because that's where we find the most valuable aspect of the treatment is. But, you know, we'll get patients who come in and they've done physical therapy before, but it was basically just a bunch of stretches and exercises. And again, that's just not what I believe is the most effective way to treat neck pain. So, let's see. So those are the 2 steps to how we successfully treat it. When you look at our goals for people with neck pain and headaches, that first goal is to reduce tension in the muscles. Muscles are almost always involved, and again, you're not going to do that except with hands-on therapy. So that first blank there would be muscles. That second blank below that is going to be mobility. So we're going to loosen up the muscles, take the stress out. At the same time, we're working on restoring the joint mobility. So those are those facet joints again. Mobility, flexibility, whatever word you want to use. And then the third one, this goes for almost everyone with neck pain, is we want to make some improvements in posture usually too. So everybody stood up tall here, would you?
Yeah.
Yeah. So we want to improve posture. And again, that's kind of a blanket statement, but the average person coming in for neck pain and headaches has got that forward head posture. And depending on how long they've had that posture, you know, you can't always fix it 100%, but making some improvements to that is going to be beneficial over time. Because again, if we're working hard with our hands to take out the pressure of the muscles and to take the stress out, we've got to also be focusing on how do we keep them nice and happy once we get them there. And improving posture is a big part of that. Okay. Questions? Blasted right through that.
Is there a way until you, like I'm waiting on surgery, to relieve the tension, maybe relieve some of the headache?
You know, so in your situation again, you're okay if we talk about you?
Oh, yes.
Okay, I figured, but just make sure.
Yeah. 'Cause like I
So-
say, I've been in, I got your ball to roll, and I got to roll and
Yeah.
roll around, and it's just the tension at night when I'm sleeping.
Yeah. Yeah, so in your situation, you've got a certain amount of, let's say, structural damage that you're not able to change, and you've got a certain amount of probably secondary stuff, like the muscles are real irritated and things like that. So what we want to do is kind of differentiate between what we can have a positive effect on and what you just have to say, okay, that's going to be a surgical thing.
Mhm.
But so chances are, yes, we could definitely improve like the headaches and the muscle tension. We would just want to know, okay, well, is this a permanent fix, or is this going to make your quality of life a little better until you have surgery, which will be more permanent, and then we can expect to keep the pain down.
Sounds good for now.
Yeah. Yeah.
Isn't surgery the last resort?
Surgery is definitely the last resort. Yeah. But it's funny. I was talking to my mother-in-law yesterday. My mother-in-law lives across the street from me. It's like everybody loves Raymond, right? Except there's no Robert, so it's not that funny. So she lives across the street, and she said, "Oh, the neighbor behind me, she's gonna have back surgery." But she told my mother-in-law, "Well, don't tell Luke. Don't tell Luke I'm getting surgery." I said, "Well, wait a minute. I'm not like a Nazi. Like it's not like you can never have surgery. It's just you want to make